Okay, so this webinar is Introduction to Contact Tracing. It's with Ashim, Khemani, and Jordan Gracey. Ashim Khemani is the president of Medcan. Jordan Gracey is the VP of Digital and Commerce. This webinar is one of a series that we do on the testing, tracing, treatment framework. We've been doing these and will continue to do these every Tuesday through the course of June. The first one was on testing, antibody screening in context. And then next week, you can see here if you we'll send this deck through and you can register for future webinars at your leisure. Ashim Khemani is the president of Medcan. There's a little bit about him there in previous roles. He was the founder of STEM Capital and the president of Medavie Blue Cross. Jordan Gracey, vice president, digital and commerce. And Ashim, why don't you start with the Safe at Work system introduction, and then we can go from there.
Great. Thank you, Chris. Good afternoon and welcome everyone who's on the webinar. So Medcan designed and deployed a Safe at Work system almost 3 months ago, very early in the days of COVID. And the idea was to look ahead and enable employers to inspire confidence in helping employees return to work or stay active at work, but perhaps remote. And really there are 4 components to this program. One is screening, and second, really our testing, tracing, and treatment. I think that all of us have become really conversant with what is the essence of COVID, what's the genesis of it, what are the clinical conditions around it, so we won't spend time on that. And screening also has really become quite native to many of us in terms of either being active at work or having employees return to work. The screening sort of schematic you see at the second half of this slide is what Medcan is using for our own employees. So Medcan Safe at Work system has been deployed at Medcan in our return to work as well. And today's focus, again, as we mentioned, is around testing, tracing, and treatment. So we see these 4 things very much going hand in hand for the next year to 2 years as we get past COVID. So screening, testing, tracing, treatment. So today we're going to talk about tracing. Next slide, please, Chris. So really, what is it? Tracing actually has been part of the public health system for decades. And it was done in the area of mumps and TB and other disease states. So it's not a new concept. Tracing clearly has become part of our day-to-day vernacular because we are also attuned to what's going on with COVID around the world. And tracing is important in order to know the spread of infection. Really, that is the essence of tracing. And the idea is, who did you come in contact with, so that public health can then take that information and mitigate further exposure. And when you've heard about the concepts of flattening the curve, really what we're trying to do is mitigate exposure and transmission of disease. And as we know, we are very much in the community transfer stage from a COVID standpoint. So tracing helps public health essentially get their arms around what the scope of exposure has been and to mitigate further exposure by isolating or instructing isolation or quarantining of individuals who have come in contact with others who have been exposed. There are 2 things very quickly that I just want to level set with you before I turn it to Jordan. Some of you may have heard or read about in the news in terms of what the World Health Organization came out with yesterday and then again retracted today. It's all in the context of tracing, really. So a position was made that if you're asymptomatic, you do not transmit. You're not a carrier who can affect other people. And the clarification is as follows, and there's still science and data that's being accumulated around this, so therefore that context perhaps is relevant. One is, it's so far estimated that about 20% of the population who will get COVID will be asymptomatic. That's point number 1. Point number 2 is that you can start to essentially transmit COVID when you're pre-symptomatic, and the current assumption is about 30%. And then the other 50% really is that you've had COVID and with the symptoms very much present, you are in contact with other people who are contacting or contracting COVID through your exposure. So when if you've read up on the World Health Organization's position from yesterday and today, that's the context behind it. Now, one thing that around contact tracing at scale, there's a hypothesis and a core belief that's developing around the world that it has to be a combination of a human endeavor and human effort, really doing the brass tacks work of figuring out who's been exposed, who have they been in contact with, contacting those individuals and logging and managing all of that activity. But given the fact that a majority of the population will get COVID over the coming months, that is not in itself a sufficient solution, although a necessary component of it. So technology and the human endeavor need to sort of play a role in harmony in order to solve for that. So today we're just going to share some perspective with you on that. Jordan, over to you.
Great, thank you, Ashim. So as Ashim mentioned, tracing is not new. Tracing had been applied to measles, mumps, and the fight against HIV and AIDS. But what you have probably heard is how manual that process really is. And once somebody tests positive, there's that need currently for that human intervention in terms of looking at that immediate support for information, giving the appropriate protocol around self-isolation, guidance on how to try to remember and notify anyone that you've come in contact with over the course of the past 2 weeks, and so on and so forth. And this is extremely manageable. And to Ashim's point, when we are looking at slowing down the spread and flattening the curve, the bandwidth around the human resources required to manage this is much too much. So that's really where, as we've all become more accustomed in our modern day lives, is turning to technology. Chris, on the next slide, please. So as we look at the fight against the pandemic and it's continuing, we look to technology to really aid us in this mission of slowing the curve and flattening the curve in COVID. We are looking to it. We are really looking for technology to help us ease that need for isolation and social distancing. Frankly, I think we're all probably starting to feel a little bit tired of being apart from our loved ones and missing key milestones and even probably our colleagues at work. But we really need to understand what we're looking to technology to help us do in this fight. And as Ashim and I mentioned, contact tracing is a laborious process. And when time is of the essence, we can't fall victim to that. We really don't have time on our side. And I think that's really a key point as we navigate the rest of this conversation. Contact tracing is not something that we can rely on in isolation, and we can't rely on the bandwidth of individuals, especially our frontline workers and care folks. So that's really where we look at introducing digital contact tracing. So what is it? Most simply, it's a mean of tracing that relies on tracking. And as we all probably know, we have the hardware right now with us. There are probably a few of us, myself included, that have 2 or 3 devices beside us, whether that's our smartphones or our wearables that are GPS enabled and have the ability to not only track what we're doing currently, but tracking who we are around. And that is such a key in terms of how we are going to be able to have tools in our arsenal in the fight for this pandemic. So due to COVID and the spread, we just frankly weren't ready for anything of this magnitude. And now we're in a bit of a perfect storm. First and foremost, as we're all aware, we have a spreading virus. Second to that, we have limited bandwidth. Our health organizations weren't ready for anything on this magnitude, and we didn't have the ability to get out in front of it. So now we're really in a strategy of management. And we are trying to manage something that we couldn't possibly have comprehended the magnitude and the impact of. So when we look at all of those things and the fact that, frankly, we haven't had the control that we would have wanted, and I think we can all see that in terms of the timelines that have been extending from our phase 1 kind of return to normalcy and even return to work, we are looking for answers and we are looking for solutions. And that's where this technology conversation is becoming more and more prominent. We are looking to technology as an answer to help us get that control that we're looking for in advance of a vaccine and be a solution for us. But Before we get to that point of what that solution can be, we really need to start thinking before we move on to the rest of the presentation, what is it that we are trying to accomplish specifically for us in this battle against COVID? And what role is it going to play in our kind of return to quote unquote normalcy, and what that specifically is going to mean for being safe at work? On the next slide, please, Chris. So while we're here and looking at this slide, a few of you may be thinking, okay, with all of these options out there, what are the solutions that could potentially be best for me and best for my organization? Before you start scribbling any names down or Googling, what we want to talk to you about is we need to be thinking strategically about how this fits within a larger strategy and part of that framework that Ashim had shared at the beginning of our webinar. When we look at what these technologies specifically do, at their core, their functionality is essentially the same. An end user would be asked to download an application, activate their Bluetooth connectivity, also probably connect their contacts, very similar to anyone who's used Instagram or is recently starting doing some TikTok dances. And that essentially will become what is tracking and tracing that individual and whether or not they come in contact with others who may be exposed to COVID or test positive for COVID. So when we're thinking of that use case, I think that's where our consideration becomes very important. If we're enabling the tracking of ourselves and enabling the tracking of others, that is really only one piece. And what does happen if someone is identified as exposed or testing positive? So again, want to just really summarize the functionality in terms of you would download an application, grant the permission and the access, and once you've enabled your Bluetooth, you are then tracked and traced. On the next slide, please, Chris. So I think where that's really important to think of is, as we just went through it, it's really kind of an apples to apples comparison, but what we were also seeing is more big tech companies getting into this game. I personally remember when I heard the news about Google and Apple coming together, I will admit that my first thought was, how great is this? Two massive tech giants who are typically in competition with each other are actually coming together to collaborate on what a solution could be for all of us globally. And then I'll admit, I thought a little bit more about it and said, okay, great. What does this mean in terms of, as I mentioned before, with some of those tech solutions, we are now tracking and tracing. So I'm sure we were all constantly refreshing and looking, what are the rates of community spread and infection, and what are the mortality rates around COVID? And how is that actually enabled? Well, that's actually enabled through data, and it was that manual tracking of results and manual reporting of the mortality rates. Now, when it's technology enabled, we can have more real-time reporting, and the plan is to have more accuracy. So both companies were really looking at how do we enable that from a data and technology perspective. And they are actually the source of a lot of the APIs that are now available to us, either those of us who want to build proprietary applications or other applications associated to a safe at work system where we can actually have the data integrated. The second that they've now launched is that integration from an iOS perspective. So for anyone on the call who's worked either within a development team or close to a development team, or even maybe with an AOR to develop an app for them, we all know that there are complications between kind of what that looks like in terms of maintaining a solution on different code bases. What Apple and Google have effectively done is said, that doesn't matter. We now actually have full control of your OS, whether you are on a Google device or iOS, and all under the guise of saying we are supporting the tracking and tracing element of the spread of COVID-19. And where I think this is an important piece for all of us is that We all have the ability to plug into solutions like this, especially as healthcare organizations, to kind of digitize that laborious process around contact tracing. But we also need to be mindful of what that means from a trade-off capability, and even some of the considerations which we'll touch on around what that means as I'm deploying this to my organization and opening this up to my employees, or potentially even mandating it as part of a return to work solution. Chris, on the next slide, please. And I think this is a perfect example. So kind of close to home and in our backyard, we have AB Trace Together, which is a really perfect example of a mobile application being used by Alberta's health services to digitize and automate that laborious manual tracking experience, So looking at how we have individuals who are end users self-identify and talk about the fact that they will be volunteering to have their information tracked and logged and part of this larger database. So if somebody is actually exposed to a positive COVID-19 case, they will be notified, you will be tracked, that will be registered, and anyone who you've come in contact with will also be notified, which is really just the digitization, of the manual process that a lot of frontline workers are going through. And this is where we need to be focused. So if we are looking at having individuals who are self-identifying, ensuring that they're answering the right screening questions, we need to ensure that that source of data is accurate. And I think we've all been privy to the fact, whether it's surveys or other tools that we've deployed in our business, that's actually a big consideration piece, ensuring that people are understanding what a fever actually means to them versus I'm just feeling warm, or being able to identify what those symptoms actually are and self-diagnose. And that's where we actually start to see some risk, not in the necessarily adoption of these technologies, but the accuracy and validation of them within a plan or within an organization. And where we just want to stress that we can't have this be something that we're looking at as a solution on its own, but rather a tool within a larger strategy, exactly like the way we've seen it work with Alberta Health Services. It's one tool that they are deploying within a larger strategy to track and monitor potential community spread and to try to flatten the curve of COVID-19. A really interesting solution on the next slide, which is actually more in line with what Medcan's efforts have been, is looking at what a technology solution is around an actual outreach, engagement, communication, and contact plan. So for those of you who may not have heard, there's been a really big activation in New York, and Salesforce being a primary contributor to this and actually enabler of this. So early on in May, there was actually the decision to grant Salesforce with the ability to manage a contact tracing program within New York. And what's very important to note about this is an experience where we don't just see technology in the form of an app being potentially cited as a solution. It's really about how does an ecosystem of a strategy work together to not only ensure that from a tracking and tracing perspective, but all the way through to communication is in place and automated. So what Salesforce had actually done is deployed their technology to integrate into a call center, a CRM database, and also the case management system. So from that identification of someone who had been infected from COVID, to be able to rapidly deploy communications, speak to what the next step should be from self-isolating and making sure that they were continuing to social distance, contact anyone, loved ones that they had come in contact with, and so on, but also associate a case ID to it was of the utmost importance, and also very similar to what Medcan has deployed in terms of our services associated to Safe at Work, which I'll actually leave Ashim to spend more time getting into the details on. So before we flip over that, just want to kind of summarize for all of you. We do see the value in a technology solution to kind of automate and digitize tracing as it relates to COVID-19. We know that there's a strain on the healthcare system, and relying on the manual processes to do that and kind of keep up with the time and rhythm that's required is too much strain on the system. However, we do not see that as a standalone solution. It really is imperative that it's plugged into a larger strategy, similar to the one that the case study that we just talked about, where there is a communications plan and a plan around safety and a plan around information and also control that needs to be put in place. And that's really where there's a bit of a shared responsibility and accountability around those of us who are responsible for helping people come back to work, helping people get back to that state of normalcy, and even quelling any concerns that people may have or anxiety around how this is going to be managed on their behalf as they come out of self-isolation and back to work. Ashim?
Thanks, Jordan. Chris, do you want to go on to the next slide? I think Jordan has covered really the grassroots context of contact tracing and the confluence of digitally enabled contact tracing combined with manual efforts. She's also gone ahead and explained really the different types of applications that are there. And in fact, there is distinction in terms of the applications that are available in the market. So certainly medium to large size employers who may be considering tracing as part of their policy framework ought to be quite thoughtful about what their guiding principles are before they make a selection in this regard, while recognizing that at any given point in time, there will be more than one competing solution that will be available through the public system. So if I may, because we have limited time, I'll just sort of recap for you the 5 things we would recommend that you as an organization consider in the context of managing return to work, and specifically as it relates to tracing. 1, I think you should have a policy-driven position around managing COVID rather than a collection of discrete activities. So you should have a company-wide perspective that's informed by your own sort of guiding principles, your own cultural predispositions, informed by what's happening from a public health standpoint. So policy-driven, that's point number 1. Point number 2, tracing has to be part of the solution. So as we've mentioned to you, screening, testing, tracing, treatment. And no matter how active the public system will be in this regard, employers will, and we as individuals will need to be actively engaged in that process. So point number 1, policy driven. Point number 2, tracing is part of the solution, not the solution. Point number 3, a recognition that it needs to be connected to public health. So you cannot have an insular, vertically integrated tracing solution because, first of all, technically it defeats the purpose because people live their lives both at work and outside of work. And so if you're truly concerned about exposure, it can happen in the entire sort of spectrum of our daily lives rather than in one concentrated context. So connected to public health is really important. And if there's any tracing solution that does not have the ability to transmit data at the discretion of the individual to public health, then that would be questionable, really. 4th is there are 2 things you need to please consider from a policy standpoint. 1, are you going to have an opt-in or a mandatory program? The decisions behind opt-in and mandatory are dramatically different. And unless there's a safety sensitive occupation that you're leading, a mandatory participation program creates a very high hurdle. So there aren't too many organizations or systems, healthcare systems in the world that have made it mandatory. And the privacy dimension is so important. So what information will you have access to as an employer? From a population health standpoint is one consideration, but from an individual standpoint is a completely different consideration. So opt-in and privacy would be a very important consideration. And in the event you're going to go ahead and activate this as part of your overall safe at work or return to work management system, communication and education, both of your managers and your HR team, but also quite importantly of your employees, is super important because it's not a one and done effort. And therefore then connecting it back to the safe at work, screening, testing, tracing, treatment, and the kind of organic nature of it till we get this behind us, which is expected to span move into sometime in 2021. So I'll pause there because I know we have only a few minutes. In the event there are any questions, happy to entertain those questions. And over to you, Chris.
Thanks very much. I'll just take us off. Thanks very much, Ashim and Jordan. We do have some questions. I'm going to work through some of the ones that have been submitted in advance. As we're working through these, I'll just draw people's attention to the Q&A function at the bottom of your screen. That's a way to submit a question as well. So Ashim, probably this goes to you. What are some ways that you suggest maximizing buy-in if an employer does adopt a contact tracing solution and pursues an opt-in framework?
Yeah, so I would really, really implore you that it has to be part of a program, not the program. And if you don't have a point of view on what your program is, then take a moment, please, to really reflect on that and solidify it. Most likely you are already, if you don't have a well-articulated program, you've already thought about pieces of it. It may be about bringing it together. That would be one element. The second element is that a subset of folks, whether it's from a leadership standpoint and a HR talent standpoint, ought to get much more educated about what tracing is. I know we've given you a bit of a high-level overview today, but double-clicking on that would be really, really important so that you can think through the entire cycle of what ifs. So what if I come across this piece of information? What will I do? What if my employee volunteers this information to me? What will I do as an employer? What are my obligations to other individuals in the workplace as a result of this information that I come across through the tracing solution? Connection to public health, some of what we've covered off. So really getting properly educated in that domain before enacting it would be great. And finally, evaluating the different technologies. Some technologies have closed loop systems. So as an example, one of the technologies that Jordan spoke to was COVID Watch. COVID Watch is a not-for-profit that's that's been sort of set up in California through a group of people from Stanford. They have created an ecosystem using the TCN coalition where actually they do not record data. And that data is sort of stored and dispatched in a way that even they cannot discover identities, if you will, of the individuals in question. Versus if you look at some other more commercial applications, they have a different ethos, they have a different sort of priority set around data. So understanding that privacy dimension will be also important as part of this exercise.
Thanks, Ashim. What about, so Alberta has its own contact tracing solution. Have you heard anything from Ontario or from any of the other provinces in terms of, are they going to come out with their solutions or are they going to leave it to private enterprise to pursue?
The likelihood is that the public health system will have technology-based solutions. They are at different stages of progress. That's the connection to the other point in our earlier discourse. One is that there will be most likely a public health solution, but that public health solution will be an interplay between we as citizens and the public health system, with really nothing to do with the employer, other than the fact that if I was someone who did sort of get diagnosed with COVID and I was in the workplace, and so what are my obligations? Well, really the obligations are with public health more so than me, and because they need to facilitate that process. So having said that, these aren't mutually exclusive, because from an employer standpoint, I think employers will continue to play as they are playing a role in screening, but they are going to play a role in treatment, and they're going to play a role in the testing aspects as well, as antibody testing becomes more mainstream in Canada.
Is there a benchmark in terms of what proportion of an employee base needs to buy in to a contact tracing app for it to be useful, or is it just more is better, essentially?
Well, more is for sure. It's got the classic network effect dynamic at play. If about 20% of the population adopts it, it can have a massive multiplier effect.
That's fantastic. I mean, that seems like a great benchmark to hit. And when you say multiplier effect, that means
Typically the adoption rates grow with the passage of time rather than at the early onset of a solution of this nature.
That's fantastic. Okay, I think this will be the last question because we are coming up to the end of our time. And you talked a little bit about this with respect to the Salesforce New York City paradigm. We've heard that people prefer human rather than technology-based contact tracing, i.e. they prefer to hear that they may have been exposed to COVID from a human being rather than by a notification on a phone. So how are the apps, this is supposed to be in an ecosystem. How does the actual handoff happen? Can you walk us through that?
Yeah, so in a very overly simplified way, Jordan may have more depth to it than I can provide to it. Really, what you've said is true, Chris, substantially true. At the same time, actually the interaction takes place between public health and the individual. The technology is a data set that becomes available to public health to know who you came in contact with, rather than that becoming a self-directed responsibility that an individual has in case they did come across with someone who had COVID or they themselves were pre-symptomatic and perhaps passed on COVID to somebody else. So it's really, really important that that is an enabler rather than the leader in essentially identifying and creating the care protocols required depending on the severity of the condition on an individual. So I think that's a misnomer to think that the technology leads that. Public health leads that effort. Really, technology enables that effort. Yeah.
I would also suggest what we want to be cognizant of, especially if this is happening within the workplaces, that there's absolutely an emotional and psychological event as well. So if somebody is being notified through a contact tracing app that they have come in contact with COVID and need to get tested, I think that's an important conversation to be able to facilitate with a human being. So to Ashim's point, if this is being deployed as part of a larger strategy, what does that mean in terms of the role that HR needs to play, or even in terms of some of what we've seen as we've deployed our nursing services? So what is that element of human care that comes into play to quell any concerns or give somebody more information, remind them of protocols and the other thing? And I think that's a really important element of where we're probably going to see a lot more of those considerations with employee health as an overall consideration within an organization, or as we're even planning to ready for additional potential waves of COVID, how do we start thinking within our organizations how we make our people feel protected and safe? And if an app of this nature is deployed as a tool for that, what are the other things that we need to put in place to help that individual feel cared for?
I think it's so interesting that this is regarded as, this is a tool. It's part of an ecosystem, but it's also a tool to get us out of this a lot faster and to contain things and to move forward and to open up the economy a lot better. That this is an integral part of this whole procedure as we move toward the next normal. Ashim, Jordan, any final thoughts as we close this out?
Well, thank you for facilitating this, Chris. Thank you, Jordan, for your expertise. And to our audience, if you're interested in exploring this further, we'd be delighted to compare notes with you.
Absolutely. And yeah, Jordan, thanks a lot. I feel like I understand this way more than I did previously as a result of your presentation. So let's talk about what happens next. So we're going to email this out. We'll email out a link to this archived, the archived version of the webinar which will be on youtube.com, Medcan Live Well. In that, you'll also get a link to the presentation deck that we had, and you'll get links to future Safe at Work system webinars, which I'm just going to take us over to, sorry, folks, Okay, so next week is what's next after an employee infection. And so Dr. Scott Gledhill, who's on our medical advisory services team, and Minu Sahi, it talks about, it's an employer-focused webinar, and it's about what happens after an employee tests positive. What do you do? It walks through in very concrete terms what's next. So that's next week. And then the following week after that, June 23rd at 12:30 p.m. is COVID-19 and safe at work strategy. So that's actually, it's bringing together the previous 3 weeks and really talking about what this all means together in context. So screening, testing, tracing, treatment, all of it together. So thanks very much, Jordan. Thanks very much, Ashim. And folks, we'll see you next week.
Thank you.
Bye for now.